Hello everyone, welcome to today's video where we're diving deep into a topic that touches countless lives around the world, understanding the levels of autism spectrum disorder. This is a journey into the complexities of autism, a condition that shapes how people communicate, interact, and experience the world. By the end of this video, you'll have a clear, comprehensive understanding of what the three levels of autism mean, how they impact daily life, and the strategies that can make a real difference. This isn't just about facts. It's about opening your mind to the diverse experiences of autistic individuals and the support they need to thrive. So let's get started and explore this fascinating spectrum together. Autism spectrum disorder, ASD, is a neurodevelopmental condition that affects how a person communicates, interacts socially, and behaves. It's called a spectrum because no two autistic individuals are exactly alike. Some may need minimal support, while others require extensive care throughout their lives. The beauty of the spectrum lies in its diversity. Each person brings unique strengths and challenges. Autism typically appears in early childhood, often before age 3, and its traits persist throughout life. What makes autism so intriguing is how it blends challenges, like difficulty with social cues, with remarkable abilities, like intense focus or creative thinking. Understanding autism starts with recognizing that it's not a one-size-fits-all condition, and that's where the levels come in. The levels of autism were introduced in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, published by the American Psychiatric Association, APA. This manual is a cornerstone for diagnosing mental health conditions, and it outlines 3 levels of autism based on the amount of support a person needs. These levels, 1, 2, and 3, help clinicians, families, and educators tailor support to an individual's unique needs. Think of these levels as a guide, not a rigid label. They focus on 2 key areas: social communication and restricted or repetitive behaviors. As we explore each level, you'll see how these traits shape daily life and why personalized support is so critical. Let's dive into level 1, the mildest form of autism, and discover what it looks like. Level 1 autism, often referred to as mild autism, describes individuals who need some support to navigate daily life. These individuals are typically highly intelligent and can often live independently, but they face challenges in social communication and behavior that can make life tricky. Imagine someone who struggles to pick up on social cues, like knowing when to join a conversation or how close to stand during a chat. They might speak in a monotone voice or find it hard to interpret sarcasm or humor. These difficulties can lead to misunderstandings, making social interactions feel like a puzzle they're constantly trying to solve. People with level 1 autism might also have specific routines they prefer to follow, and disruptions to these routines can cause stress. Despite these challenges, their strengths, like attention to detail or deep knowledge in specific areas, often shine through. The key is providing targeted support to help them thrive. Supporting someone with level 1 autism is about understanding their unique needs and creating an environment where they can succeed. For example, environmental accommodations, like a quiet workspace or clear instructions, can help them process information more comfortably. Social skills training is another powerful tool, teaching them how to read facial expressions or handle small talk. Mental health support is also crucial, as anxiety and depression can arise from feeling isolated or misunderstood. Imagine the relief of learning strategies to navigate a workplace conversation or cope with unexpected changes. These individuals often benefit from coaching to build confidence in social settings, whether at school, work, or in their community. With the right support, people with level 1 autism can lead fulfilling, independent lives, leveraging their strengths to achieve their goals. Moving to level 2 autism, we see individuals who need more substantial support to manage daily life. The challenges here are more pronounced than in level 1. Social communication difficulties are noticeable, even with support in place. Someone with level 2 autism might use simpler sentences, repeat phrases, or struggle to respond appropriately in conversations. Their nonverbal communication, like eye contact or gestures, can seem unusual or inconsistent, which can make social interactions feel unpredictable. They might also show repetitive behaviors like rocking or lining up objects that are obvious to others and can interfere with daily tasks. Changing focus or routines can cause significant distress, making structured environments essential. These individuals often need consistent help to navigate social settings and daily activities, and their challenges can make independent living more difficult without ongoing support. Supporting someone with level 2 autism requires a more intensive, hands-on approach. Occupational therapy can be a game changer, helping individuals manage sensory sensitivities or improve motor skills. Speech and language therapy can enhance their ability to express themselves clearly, reducing frustration. Structured routines and visual aids, like picture schedules or social stories, provide predictability and reduce anxiety. Positive reinforcement, such as praising desired behaviors, encourages progress and builds confidence. Imagine the comfort of knowing exactly what to expect in a day, or having a visual guide to navigate a tricky social situation. These strategies create a supportive framework, allowing individuals with level 2 autism to engage more fully in their communities while addressing their unique challenges. Level 3 autism, sometimes called severe autism, represents the highest level of support needs on the spectrum. Individuals at this level face significant challenges in communication, behavior, and social interaction that profoundly impact their daily lives. Many have minimal or no verbal language, relying on alternative communication methods like gestures, pictures, or assistive devices. Their behaviors, such as intense repetitive actions or extreme sensitivity to sensory input, can be highly disruptive. For example, they might react strongly to loud noises or insist on specific routines, like eating the same food every day. These individuals often require around-the-clock care and cannot live independently. The complexity of their needs makes consistent, intensive support essential to ensure their safety and well-being. Yet, even within these challenges, their unique personalities and strengths can shine through with the right care. Supporting individuals with level 3 autism involves a comprehensive, multidisciplinary approach. Caregivers and professionals work together to create structured environments that provide stability and predictability. Communication aids, like picture exchange systems or speech-generating devices, can help bridge the gap for those with limited verbal skills. Sensory integration therapy can address extreme sensitivities, helping individuals feel more comfortable in their surroundings. Behavioral interventions, tailored to the individual, focus on reducing distress and promoting positive behaviors. Imagine the impact of a calm, predictable environment for someone overwhelmed by sensory input or change. Family support and respite care are also vital, ensuring caregivers have the resources to provide consistent, loving care. These strategies aim to enhance quality of life, helping individuals with level 3 autism connect with the world in meaningful ways. One of the most powerful takeaways from understanding autism levels is that support must be tailored to the individual. No two autistic people are the same, even within the same level. A person with level 1 autism might excel in academics but need help with social skills, while someone with level 3 autism might thrive in a structured setting with the right communication tools. This individuality is what makes autism so fascinating and complex. Support plans should consider strengths, challenges, and personal goals. For example, a child with level 2 autism might benefit from a visual schedule at school, while an adult with level 1 autism might need workplace accommodations to manage stress. By focusing on the individual, we can create environments where autistic people feel understood, valued, and empowered to reach their full potential. Getting a diagnosis of autism involves a thorough evaluation by a team of specialists, such as psychologists, developmental pediatricians, or speech-language pathologists. This process includes observing behaviors, reviewing developmental history, and using tools like the Autism Diagnostic Observation Schedule, ADOS. For children, parents might notice early signs, like delayed speech or lack of social engagement, prompting a visit to a pediatrician. Adults seeking a diagnosis might recognize challenges in social interactions or routines that have persisted since childhood. A diagnosis provides clarity, opening the door to tailored support and resources. It's a critical step in understanding where someone falls on the spectrum and what level of support they need. The process can feel overwhelming, but it's a gateway to better understanding and advocacy. There are many misconceptions about autism that can cloud understanding. One common myth is that autism is caused by vaccines. This has been thoroughly debunked by numerous scientific studies. Another myth is that autism can be cured. Autism is a lifelong condition, not a disease, and the goal is to support individuals in living their best lives, not to change who they are. Terms like high functioning or low functioning can also be misleading, as they oversimplify the complex needs and strengths of autistic individuals. By focusing on levels of support, we move away from these labels and toward a more nuanced understanding. Dispelling these myths helps create a world where autistic people are accepted and supported for who they are, not judged by outdated assumptions. Autism doesn't just affect the individual, it impacts entire families. Parents and siblings often navigate a mix of emotions, from love and pride to stress and uncertainty. Caregivers of individuals with level 3 autism, for example, may provide round-the-clock care, which can be physically and emotionally demanding. Families of those with level 1 autism might focus on advocating for accommodations at school or work. Support groups, respite care, and educational resources can make a huge difference, offering families tools to cope and connect. The journey can be challenging, but it's also filled with moments of joy, like celebrating a child's first words or an adult's newfound independence. Understanding the levels of autism helps families advocate for the right support, strengthening their ability to thrive together. The concept of neurodiversity views autism as a natural variation of human experience, not a flaw to be fixed. This perspective encourages us to celebrate the unique strengths of autistic individuals, like their creativity, focus, or unique problem-solving abilities. For someone with level 1 autism, this might mean excelling in a career that values precision. For someone with level 3 autism, it could mean finding joy in a favorite activity, like music or art. Embracing neurodiversity means creating a world where autistic people are valued for who they are, not pressured to conform to neurotypical norms. This shift in mindset fosters acceptance, reduces stigma, and opens doors to meaningful inclusion in schools, workplaces, and communities. Research on autism is constantly evolving, offering new insights into its causes and support strategies. Scientists are exploring genetic and environmental factors, like family history or prenatal exposures, to better understand why autism develops. Advances in technology, like assistive communication devices, are transforming lives, especially for those with level 3 autism. Ongoing studies are also refining support strategies, from sensory therapies to social skills programs, to better meet individual needs. The future holds promise for even more personalized approaches, ensuring that autistic individuals can live fulfilling lives with the right support. Staying informed about these advancements empowers families, educators, and communities to advocate for better resources and opportunities. Thank you so much for joining me on this deep dive into the levels of autism spectrum disorder. We've explored how level 1, 2, and 3 autism shape lives in unique ways, from mild challenges to profound needs. We've seen the power of tailored support, the importance of accurate diagnosis, and the beauty of embracing neurodiversity. This journey has shown us that autism is not just about challenges. It's about celebrating the incredible diversity of human experience. If you found this video helpful, please give it a thumbs up, share it with someone who might benefit, and hit that subscribe button for more educational content. Drop a comment below to share your thoughts or questions. I'd love to hear from you. Let's keep learning, supporting, and advocating together. See you in the next video.